my name is Madi. Today I'm going to be demonstrating the ophthalmic portion of the video. I have no nails and I have my badge on as well as the nightingale uniform. I do have my head, I have my supplies, tissues, some gauze, a rag, my eye drops, as well as some gloves. So today, my first thing first, I'm going to make sure I have the 6 rights to the medication are right patient, right time, right dose, right route, right patient, right patient, right route, right dose, right time, right documentation, and right medication. So, first things first. I'm going to knock on the door, introduce myself, say hi, my name is Monty. Today I'm going to be your nurse. I'm going to be applying your medication for you. The doctor did order you Timolol 0.25%, 1 drop in each eye twice a day. I'm going to also hand hygiene, make sure my hands are clean. Do you have any questions for me? Patient doesn't have any questions. So first things first, I'm going to make sure that I check the medication as well 3 times in the MAR. So first things first, I'm going to check the medication, make sure it's the correct medication, check to make sure it's the correct medication in the patient's chart. Yes, it's the correct medication. Do you mind telling me your last name and your first name? Patient, let me know the first name, the last name, and your date of birth, please. Date of birth. Also, I'm going to check the patient's wristband to make sure I have the correct first name, last name, and date of birth, as well as the chart to make sure I have the correct patient. Okay, perfect. Do you have any medication allergies? The patient does not have a wristband that says medication allergies, as well as the chart does not say any medication allergies, and patient verified that they have no medication allergies. So I'm gonna go ahead and let the patient know, check the medication. Let the patient know that I'm gonna check the medication again, make sure I have the correct medication. I have the correct medication. I'm gonna be going ahead and putting on some gloves. I'm gonna go ahead and lay you back in your seat, okay? In your bed. Just to make sure, this is a medication that does have to be placed with you laying back. So I'm gonna go ahead and place the patient back. I just wanted to let you know that the medication that you're receiving today does help with your glaucoma. It helps relieve pressure in your eyes. And then I also want to let you know some common side effects that may be happening. Some common side effects could be like dizziness and fatigue, but if they start to feel extremely worse, just go ahead and press your call light for me and let me know. Or if it happens during the medication process, go ahead and let me know. And then some adverse side effects would be having shortness of breath or a fast heart rate. And if you start to feel like you have those kind of side effects, then just go ahead and notify me, and then I will notify your provider. You have your call light next to you. And then I also want to let you know that you may feel a slight burning when I do apply the medication in your eye, but it should go away in a matter of seconds. Okay, so do you have any questions for me? No? Okay. So I'm just going to go ahead and check the medication again. Okay, medication in the MAR is perfectly fine. Okay, perfect. So now we're just going to go ahead and first, I just want to make sure that your eyes are clean. I'm going to go ahead and clean your eye with a rag, which will be this rag right here. I'm going to start from the inner into your outer eye. And then I'll get started with the medication process, okay? Okay, if you start to feel any uncomfortableness, just go ahead and let me know. So first things first, I want to wipe from the inside, apply a little bit of pressure, and go to the outside. Perfect. Now I want to get a clean part of the rag. Okay, start from the inside, work my way to the outer. Perfect. Okay, I'm gonna go ahead and throw my rag away. Okay, so now that that is done, I'm gonna go ahead and take my gloves off. throw these away. And then I'm gonna hand hygiene again. Apply some new gloves. Okay. How are you feeling? Good? Okay, cool. All right. As soon as these gloves come on. Okay. So first things first, I'm gonna go ahead and make sure that I'm using my dominant hand to apply the medication and using my non-dominant hand to pull down the inner conjunctival sac of the patient's eye. I'm gonna make sure that I'm holding my hand 1 to 2 centimeters above the patient's eye. Okay, Ms. Dupo, I'm gonna go ahead and hold the inner of your eye slightly down so that I can open up your conjunctival sac so that I can place the medication there, okay? Okay. All right, holding my dominant hand, and I'm also gonna place my hand on the patient's forehead. I'm gonna place my hand on your forehead, and then I'm gonna do 1 drop. Okay, perfect. 1 drop in the patient's eye. I'm gonna go ahead and throw away that tissue, and then I'm gonna use a new tissue to go ahead and apply some pressure for 30 to 60 seconds, okay? So I'm holding pressure for 30 to 60 seconds. Go ahead and blink for me. Perfect. I'm gonna go ahead and throw that away. So now I'm gonna do your other eye, and we're gonna do the same exact steps that we just did, okay? Okay, so I'm gonna get a new gauze, and I'm gonna go ahead and place my hand on the patient's forehead. Make sure that I'm pulling down to see the conjunctival sac, 1 to 2 centimeters, 1 drop. Perfect. Okay, new tissue. Go ahead and hold that for 30 to 60 seconds. Go ahead and blink for me. Perfect. How are you feeling? Good? Okay, perfect. Go ahead and throw that away. Alrighty, so now that you're feeling good and I don't see any side effects or any adverse side effects, I'm gonna go ahead and lift you back up in your bed, or if you're in a comfortable position, you let me know. Okay, I'm gonna lift you back up. So I'm gonna lift the patient back up in their bed. I'm gonna go ahead and take off my gloves and throw those away. Okay, perfect. I'm gonna hand hygiene. Okay, your bed rail is up, your call light is next to you. Go ahead and give me a call if you need anything. And then I'm gonna go ahead and document my results in the chart.